October is Pregnancy and Infant Loss Awareness Month, and today we're talking about miscarriages. A miscarriage is the sudden loss of a pregnancy before the 20th week. Losing a baby during pregnancy through a miscarriage is often a taboo subject that's associated with a lot of shame and stigma. But the truth is, about 10 to 20% of all known pregnancies end in miscarriage. The most common cause for this is that the unborn baby is unable to develop and grow properly. The real number is likely even higher because a lot of women will have a miscarriage before they know that they're pregnant. Symptoms that you might experience during a miscarriage are vaginal bleeding. This can either be heavy bleeding or light bleeding known as spotting, cramping in the pelvic region or the lower back, and passing fluid or tissue through the vagina. The most common cause for a miscarriage is chromosomal abnormalities such as having too many or too few chromosomes, which can result in either an embryo not getting formed, an embryo getting formed but is not able to grow properly, or a molar pregnancy in which both sets of chromosomes come from the sperm and either a fetus is not formed or if it is formed, it's unable to survive and grow. Rarely, some other causes such as uncontrolled diabetes, uterine or cervical abnormalities, hormonal imbalances, or infections may be responsible for a miscarriage. Some things that are often blamed for but don't actually cause a miscarriage are exercise, especially if it's something that your body is used to doing and that you've been cleared by your doctor to do, engaging in sex, having arguments, using birth control pills before getting pregnant, and working, unless you're exposed to high levels of harmful chemicals or radiation. Women often associate a recent fall or a stressful event with a miscarriage, but in most cases, this is something that may have happened around the same time and is still fresh in our minds, but not the actual cause for the miscarriage. So what are the next steps after suffering a miscarriage? Once a medical provider has confirmed your miscarriage, you have a few options depending on your symptoms and your preference. The first of these is expectant management. If you don't have any symptoms of an infection, you can just wait for the pregnancy products to naturally be expelled from your body. This usually takes about 2 weeks, but can take anywhere up to 8 weeks. The second is medical treatment. In this, a combination of medications are given in order to aid your body to expel the rest of the pregnancy tissue. And the third is surgical treatments. This can either be a dilation and curettage or a DNC, in which the cervix is dilated and the remainder of the pregnancy tissue is removed using an instrument, or a dilation and evacuation, in which the cervix is dilated and the remainder of the pregnancy tissue is removed using suction. It's possible to get pregnant right away in the next cycle after suffering a miscarriage. But if you're planning a pregnancy, it's important that you are both physically and emotionally ready to get pregnant again. As someone that has personally experienced miscarriage, I just want to say that being a doctor or knowing how common this is didn't make it any easier. So give yourself some grace. It's okay to feel all of the feelings, but the one thing that you don't need to feel is any kind of shame or guilt. This is not your fault, and you are not alone. If you have recently suffered a miscarriage and are struggling, speaking to a family member, a friend, or seeking professional help can be useful.